So the symptoms are abrupt. There can be weakness on one side, numbness on one side, problems with speech, problems with vision, problems with walking, where almost they're walking as if they're drunk. You need to call 911 immediately in order to go to the closest emergency room. It's very important that you don't drive yourself if you think that you're having symptoms of stroke. And the reason is because stroke can worsen over time. So if you start off with mild symptoms, there's no way of knowing whether they're going to get more severe. So if you're driving, maybe you can't move your arm, maybe you can't see very well, so it would be a bad idea. You really need to call 911 in order to be taken to the emergency room that's closest to you. When people have strokes, many times their blood pressure is very high, so they can give medicines on certain ambulances. They can make sure that you have a good oxygen level and call ahead to the emergency room in terms of notification. We're bringing in a stroke, all hands on deck. So we know that a stroke occurs from not enough blood getting to the brain in a period of time. You want to try to limit the degree of damage to the brain. So the people who come in right away and come in faster and are treated faster usually do better in terms of recovery, maybe getting totally back to normal. The best advice I can give someone who thinks that they might be having a stroke is to call 911 and go to the closest emergency room, because really time is brain. So the longer they wait, the more likely it is that the brain may be irreversibly damaged. It's important, even if you're not sure, to go into the emergency room right away so they can decide, are you having a stroke or not, and then what's the appropriate treatment.